as concerns grow about the coronavirus outbreak. The U.S. set a new record, more than 60,000 new cases in a single day. 37 states are seeing an increase in new infections as the situation grows worse in the South and West. Our chief national correspondent Matt Gutman starts us off in the coronavirus hotspot, Arizona. Good morning, Matt.
Hey, good morning, George. And we're seeing how the COVID can impact every aspect of the public health system. There are over 120 members of the Phoenix Fire Department right now who are out because of COVID or being quarantined. That's nearly 10% of its entire workforce, and that as ICUs here are filling up. And perhaps what's most disturbing is that it's impossible to assess how much COVID there is in the community, because if people even can get tested, many are waiting for 10 days or more for results.
This morning, the national surge in cases is triggering a testing crisis. In Phoenix, where the COVID positivity rate for swabs is nearing a shocking 30%, Mayor Kate Gallego saying the lines for testing look like those in a developing country.
We had 13-hour waits in Phoenix. It was heartbreaking for me to watch residents who were aching, sick, and sweating, coughing, trying to refill their gas tanks on the street because they had run out while waiting for a test.
Labs are backlogged and some testing sites are short on supplies. On Tuesday, the Department of Health and Human Services announcing new testing sites in hotspot areas in Louisiana, Texas, and Florida. But Phoenix's mayor telling us so far no federal help in Arizona, including the Maryvale area, one of the zip codes with the highest COVID rates in the country. Phoenix Fire Station 25 handles Maryvale. They're constantly on calls.
So we just learned that this is a possible COVID call. Everybody's got N95s on, and about 50% of all the calls that this station does are COVID calls.
Martin Molina sitting there telling paramedics he has splitting headaches and a fever. Martin, like so many in this community, is an essential worker. He's in construction. He's now headed to the hospital. Yesenia Lopez has just given birth to their infant son.
What are you going to do?
What am I going to do? I don't know.
As she speaks, she reaches for her pendant of St. Jude, which couldn't stop those tears.
Who's going to take care of you?
I mean, my mom can help me out, but I don't know. It's hard, but we'll go through this.
CDC data showing Latinos and African Americans are 3 times more likely to contract the virus than their white neighbors, and twice as likely to die from it. In Florida, Diego Ferreira says his grandmother was diagnosed and released from the hospital within hours. 4 days later, the 7-year-old matriarch succumbed to the virus. And he worries that other members of the community may face similar struggles.
A lot of folks that are Hispanic or don't speak the language or can't defend themselves, such as my grandmother, are scared and they don't know.
This morning, the daily death rate from COVID-19 now increasing in a dozen states. 21 states now have reversed, paused, or delayed reopening measures.
We want to reopen the schools. Everybody wants it. The moms want it, the dads want it, the kids want it.
Still, President Trump saying Tuesday that schools across the country need to reopen in the fall despite the surge in cases.
We're very much going to put pressure on governors and everybody else to open the schools, to get them open.
And in Florida, where 56 ICUs are at capacity, the state is sending 100 nurses to Miami. In San Antonio, the military is sending respiratory therapists there. And here in Phoenix, the mayor telling us she has been speaking with FEMA. She says they need help here. Cities like Phoenix cannot handle COVID just on their own. George.
Matt Gutman, thanks very much.